Well, hello, and welcome to Module 15. During this module, we will be discussing pediatric gastrointestinal disorders. So some of the more common ones that we will be reviewing are gastroenteritis, which laypersons may call the stomach flu. That's usually considered the diarrhea part of it, where it's lasting for a while. And we will be discussing constipation. That's a very common gastrointestinal disorder in children. It's actually the number one reason why kids present to the emergency department with abdominal pain. Usually turns out to be constipation. Other less common disorders, but also important that we need to discuss, are failure to thrive, and that's when kids are just not growing and they're not gaining weight. We'll also talk about Hirschsprung's disease, and Hirschsprung's is a congenital condition where the part of the rectum and the colon fail to develop a normal system of nerves, so you'll eventually see some kind of constipation when the infant is born. Gastroesophageal reflux, which you know is GERD, if it is a disease. Gastroesophageal reflux, or just GER, a lot of times these babies are just what we call happy spitters. So you feed them and they just spit up a little bit. That's gastroesophageal reflux. But disease is when it's causing burning, problems, pain, arching the back of the baby, and so forth. Appendicitis, cleft lip and or palate. Pyloric stenosis, which is a narrowing of the opening from the stomach to the first part of the intestine, the small intestine, which is the pylorus. And intussusception, which is like a telescoping of the intestine. One part of the intestine moves inside the other part of the intestine and can cause pretty significant GI disturbance, many times needing surgery. And inflammatory bowel disease. So when working through this module, you want to think about how the nurse would assess for these different conditions, how the nurse would manage these conditions, and how the nurse would help the family with all of these different conditions. Think about, again, if the child has dehydration, what you need to assess, how you would figure out if that child is dehydrated and what you need to do about it, how you would calculate the right amount of fluids that the child would need for rehydration. And that's it. Enjoy the module.